Hi everybody, welcome to Healthline. I am Gregory Zarian. Okay, so we're already into this new year. Have you kept your New Year's intention? Have you started going back to the gym a little bit more? Are you walking with your family? You know, around the holidays we kind of drink a little more, eat a little more, we have more cookies, we're not as active as we want to be. And listen, you get a pass, it's the holidays. As we said last month, it's just about getting back into a routine. Baby steps turn into a habit turns into a lifestyle transformation. So just want to make sure that you are on track, you're drinking more water, you're getting more sleep, and you're bringing your friends and your family along with you. The conversation today is about hiatal hernias and heartburn. Joining us from Adventist Health Glendale is Dr. Frederick Boghossian, medical doctor who specializes in gastroenterology. Doctor, welcome.
Thank you, it's a pleasure.
No, it's a pleasure for us because I have lots of questions.
Go ahead.
Doctor, first of all, tell us a little bit about your medical history, where you studied and what brought you to this specialty.
Right, so I went to medical school at St. George's University, School of Medicine, and did my internal medicine residency and gastroenterology fellowships at Martin Luther King Hospital. What
attracted you to gastroenterology?
Well, you know, the disease processes of the GI tract were most interesting to me out of all the disciplines in internal medicine, and I like doing things with my hands, procedures. So the most procedure-oriented field, in my opinion, is gastroenterology. So those two are very good reasons for me to pursue GI. And
when you say GI tract, break down for us what is the GI tract.
Right. So gastroenterology, the discipline of gastroenterology, it encompasses the study of all the disease processes that stem from the esophagus, stomach.
So let's break it down. So I'm drinking water.
Right.
And I drink it in mouth, into throat, and the esophagus starts here.
Right. So once you swallow the water,
yes.
Now the water enters the GI tract, which is the esophagus.
Okay.
And then it proceeds down into the stomach, into the small intestine, thereafter into the large intestine. The gastroenterology study also includes the pancreas,
okay.
The pancreas organ.
And so then everything below that is then called?
The below the pancreas?
Yes, sir.
Well,
because if this is gastroenterology, what is the word for the below that? Is there a word for that?
No. The gastroenterology, the discipline of gastroenterology includes all of the organs that I just mentioned, from the esophagus down to the rectum, which is part of the large intestine.
Oh, it's kind of like the freeway.
There you go.
The freeway of your body. Okay, and I love that you say discipline. I really respect that you address it as the discipline. I have a question. So, in regards to heartburn, can you get heartburn from tomatoes? Can you get heartburn from alcohol? And can you get heartburn from Diet Coke? When we come back, I'll give you the answer. Don't go away. Welcome back to Healthline. I am Gregory Zarian. Once again, U.S. News & World Report names Adventist Health Glendale among best hospitals, ranking number 16 in the Los Angeles metro area, number 28 in all of California, and high performing in 5 categories of care. Adventist Health Glendale is also proud to continue to be voted as best hospital in Glendale by Glendale News Press voters for the 4th year in a row. Congratulations, Adventist Health Glendale. Our mission here is to give you as much information as we can so that you can be the healthiest you can be. The conversation today is all about hiatal hernias and heartburn. And before we left, I left you with a trivial question. Can heartburn be caused by tomatoes, Diet Coke, and alcohol? Joining us from Adventist Health Glendale is Frederick Boghossian, and his specialty is gastroenterology. Doctor, can heartburn be caused by all of this?
You're right, Gregory. Studies have shown, and they've determined, that certain foods cause loosening of that sphincter muscle, which allows acid to reflux into the esophagus, and they include the caffeines, most notably. So that includes coffee, tea, chocolate, soda, spicy foods.
So everything we love to eat.
All of your favorite foods, that's right. So spicy foods open that sphincter muscle. Fatty foods, alcohol, nicotine, tobacco, those are the foods. So if you want to minimize the acid reflux, good idea to stay away from those foods.
So when you say minimize, and then we'll dive into what heartburn is, when you say minimize, are you talking about like a cup of coffee? A lot of people get heartburn and reflux from coffee.
Right.
What is minimal?
So acid reflux varies from one person to the next. So there are people who can consume 1 cup of coffee and they're able to retain or decrease the amount of acid reflux. On the other hand, there are other people that 1 cup of coffee is just too much caffeine intake for them. So that means they need to stay away from caffeine in entirety. So those are the patients that I tell maybe it's a good idea to maybe fool yourself and drink some decaffeinated coffee or tea, and that way you'll minimize the symptoms.
When we think of heartburn, and when you say minimize symptoms, let's just dive into that. Well, what is heartburn?
Good question. So heartburn is that burning sensation that people tend to feel radiating up into the chest, and that happens as a result of that sphincter muscle that's supposed to be closing off the pathway of the stomach to the esophagus. That sphincter muscle loosens up and opens up during the day, allows acid to regurgitate up into the esophagus.
Why does that happen? Is it just because, is it kind of like the sphincter muscle is like gasping for air? Or is it, I mean, could you use that analogy?
So there are 2 main reasons why that sphincter muscle could loosen up and open, allow acid refluxing. Number 1 could be those foods that we mentioned.
Okay.
So everyone is built the same way, and that sphincter muscle, it's sensitive to those caffeine, spicy food, fatty food, alcohol, and tobacco. So if you consume those products, then that muscle will loosen up, allow heartburn to take place. Another good reason why acid reflux can take place is if you have an underlying hiatal hernia. So a hiatal hernia is something where it's an anatomical change, and that's where the stomach herniates out of its normal position up above the diaphragm and into the chest. That's a hiatal hernia, and when that takes place, that sphincter muscle is no longer closed, it's open, and it could lead to the eventual development of reflux. And one more point I'd like to make, hiatal hernias are very common in the elderly group, in our geriatric patients, and a statistic that came out is 60% of all patients over the age of 60 years of age have a hiatal hernia.
It just happens?
It could happen. Very good question. Why does a hiatal hernia develop? It happens due to age or any reason that causes increased abdominal pressure to take place. And what are examples? Well, people who cough substantially or sneeze a lot, they are causing increased abdominal pressure. People who vomit a lot, that could cause hiatal hernias. For people who are healthy and they're exercising, those people who do bench pressing, sit-ups, things that are healthy for you, good for you, guess what? Those exercises cause increased abdominal pressure and can eventually lead to the development of a hiatal hernia. And also obesity. Another reason, obesity causes increased pressure in the abdominal cavity.
Over 70% of this country is obese. And we claim to be the healthiest country in the world.
Right, and I want to say one other thing for the females. For women who have pregnancies increase the intra-abdominal pressure, hence increase the likelihood of developing hiatal hernia for women.
I want to address the hernias in just a little bit. In regards to what is considered a normal heartburn, meaning we all get a little bit of it. When do we need to be aware that something could be wrong?
Okay, good question. So you're right. Everyone gets occasional, periodic acid reflux or heartburn. And again, it's related to the dietary intake. But when should you be concerned? Good question. Whenever you have chronic acid reflux, meaning if you're having heartburn for days and weeks and months at a time, then that means this is becoming a chronic issue when it's persistent for months. Okay. And therefore, you need to get that evaluated because heartburn could be harmful also.
But then chronic acid reflux, which then there's GERD, there's Barrett's esophagus. All of that could also lead to like esophageal cancer and things that at some point could be deadly.
That's right. So as I was alluding to, if you have chronic acid reflux, if you're having heartburn for months, then that's a good sign for you to go in and get it evaluated by a gastroenterologist, meaning get an endoscopy done. And during an endoscopy, the physician is able to visualize the esophagus and make note, do you have changes, atypical, abnormal changes to the esophageal tissue like Barrett's esophagus, as you mentioned, which is a precancerous change of the esophagus. And if that persists, acid reflux, then that Barrett's can eventually lead to esophageal cancer. So yes, there are instances where heartburn can be detrimental and could lead to harmful effects like cancer.
We're going to dive into solutions when we come back. More with Dr. Boghossian when we come back. Don't go away. Welcome back to Healthline. I am Gregory Zarian. Okay, the conversation is all about heartburn and hiatal hernias. And before the break, Dr. Boghossian, our guest from Adventist Health Glendale, we were talking about signs and symptoms and what to do. And as I've shared here, I smoked 2 packs of cigarettes for 20 years. The chronic reflux, the burning, the sensation, I finally just said I'm done and I quit smoking. Bottom line is, if you are dealing with any of these chronic symptoms from drinking, from coffee, from over-acidic foods, stop them. Make an appointment, call your doctor and say, hey, you know what, this is what's happening. I need some help. Our mission here is to have you be as healthy as possible. Joining us from Adventist Health Glendale is Dr. Frederick Boghossian, superstar of gastroenterology. Doctor, so just say somebody is suffering from chronic heartburn, chronic reflux. We mentioned a little bit about Barrett's esophagus, GERD. What is treatment for all of that?
Right. So patients who have chronic reflux or Barrett's.
And when we, I just want to be clear, when we say chronic, it's constant, doesn't go away, doesn't go away.
So the way you manage that is, number one, dietary restrictions. Stay away, decrease those caffeines, coffee, tea, chocolate, soda,
and one thing I would say too, and see what it is. Like if you drink 2 cups of coffee and you have this chronic clearing of the throat or the reflux, have tea one morning and see what happens. Give yourself time to find out what works and what doesn't work.
Right.
Because just because if I go to you doesn't mean you can tell me what's not going to work, but I'm the one that's in charge as to what I put into my body.
Exactly.
Thank you.
So your dietary restriction is critical. Stay away from those triggering foods, number one. Number two, lifestyle changes. Decrease the activities that you may be doing that's causing the increased abdominal pressure, such as bench pressing, sit-ups, and things of that nature. Sometimes, something as remedial as, if you're slouched over. So if you have a desk job and you're working over a computer and you're slouched over with a tight-fitting belt or pants, that also constitutes increased abdominal pressure and could lead to this type of reflux. So lifestyle changes, minimize those causes that may lead to increased abdominal pressure. Dietary restrictions, stay away from those foods. And lastly, take medications for symptomatic relief. Acid suppressing medication and gas relieving medication for the bloating.
But there's also been a conversation out in the world now that some medications can have harmful side effects. They're called PPIs. Right.
So recent studies have determined that long-term use of PPIs can be related to certain side effects, most notably for our elderly patients.
You said from the age of 60 and above.
Osteoporosis. So osteoporosis can develop in those patients who take extended period of PPI management.
Is there an alternative to a PPI?
Good question. So you could use H2 blockers, which are histamine 2 blockers. You could utilize the antacids, which are the bicarbonate substances. So you could use that as a good means of decreasing the acid.
And what about holistic studies? There's a big conversation where people say doing a shot of apple cider vinegar helps suppresses some of the acid reflux.
Right, I've heard that also,
Okay.
but studies have been done, and there is no study that has suggested that there was any legitimate benefit from these herbal or non-medication substances. So you could utilize them, but
Great.
Yeah.
But and it goes back to you being in charge of your body. Have a conversation with your doctor. And one thing that I want to throw out there too is there's so many people that watch us that share with me out in the world where, you know, Gregory, you talk about doing this and getting healthy and working out and all these things, and I sit at a desk every day. We've talked about this on Healthline, that if you actually stand up for about 10 minutes every hour, you lose weight. If you stand up at your desk and then you can do little exercises, you're not sitting like this anymore. You're actually allowing your body to circulate better, to not get cut off at the abdomen. So it's actually beneficial and helpful to get up, to move, and not become sedentary.
That's right, for many reasons. You're right.
Hiatal hernia, doctor. We addressed it a little while ago. Are they as common in women as they are with men?
They are, and for opposite reasons, for reasons that are not same. So for women, most common reason to develop hiatal hernia is, as I mentioned earlier, pregnancy. So with pregnancy, there's an increased abdominal pressure that pushes and everything, the anatomy moves superiorly up, and therefore the stomach can move up through the diaphragm and develop a hiatal hernia. For men, typically it could develop for those men who apply pressure to the abdomen related to exercise. So men who work out, do bench pressing and sit-ups, those are very good reasons why you could develop a hiatal hernia for men.
But you still want men to do bench presses and sit-ups and stuff like that. Is it about form? Is it about talking to your trainer, or when you actually do it, make sure you're doing it the correct way? Because like, if you break it down to a sit-up, a lot of people flail forward, and that's not a proper sit-up.
Right. So if you use good technique, if you don't overdo things, like for instance, when people work out, they tend to do an extra 5 more sit-ups or extra 5 more pull-ups with the bar.
Push-ups, yeah.
And they feel it burn, and they think they're getting more intense workout and more benefit. But in actuality, when you feel like you're overdoing it and you're pushing, that's when you cause harm anatomically, and you could very well develop a hiatal hernia.
And also what happens too is when you have that extra 5 more and you're already so fatigued, your form is off and you may get hurt.
That's right. Yeah, you could cause a little trauma there.
And here's the thing is I say no to trauma. More with Dr. Boghossian when we come back. Don't go away. Welcome back to Healthline. Joining us is Dr. Frederick Boghossian, gastroenterologist from Adventist Health Glendale. So doctor, we spent quite a bit of time talking about heartburn. We were practically wrapping out on hiatal hernias. What are lifestyle choices for hiatal hernias? I know you said drink. And are they connected at all? Are hernias and heartburn connected?
Sure, exactly. So once you have a hiatal hernia, the hiatal hernia causes that sphincter muscle that's supposed to be closed between the esophagus and stomach. With a hiatal hernia, right? With a hiatal hernia, that sphincter is no longer closed. So the movement of the stomach up into the chest leads to that sphincter muscle remaining open and no longer closed. That's why a large percentage of patients who have hiatal hernias, they have associated heartburn.
Got it. Okay. So then so you invite all of us to look at our lifestyle, look at what we eat, how we take care of ourselves. What are surgical then options if this does not work then?
Well, good question. So the initial management of heartburn as a result of the hiatal hernia is, again, as we said earlier, just to reiterate, lifestyle changes, minimize those applied pressure and increased pressure to the abdomen. Number 2, the dietary restrictions. Number 3, the medications to help relieve the symptoms. Typically, we incorporate this type of management for 2 to 3 months. And we bring the patient back, we assess the patient. If the patient has not clinically improved after a 3-month course, then these are the patients that are good candidates to see a surgeon, and the surgeon will evaluate the patient, and the surgeon will determine whether the patient is a good candidate for surgical repair of the hernia. And that's one good reason to send a patient to the surgeon for evaluation. Another reason, other than failure of medical management, would be having a patient have the hernia repaired to minimize their long-term use of PPIs. That's critical, especially as you touched on earlier, the side effects of PPIs. So patients may not want to subject themselves for taking PPIs long-term for the rest of their life.
And one thing I like that you said side effects. A lot of people don't pay attention to what is on their medications bottle.
Right.
Read the side effects. Talk to your doctor about what side effects are and what they possibly can do to you. It's an ongoing conversation. Just say somebody comes in and the sphincter in their esophagus needs repair. I've heard here on Healthline that they can also do a single incision surgical procedure as well too. Is that true? A SILS repair.
That's correct. So there's a single incision laparoscopic surgery. That's what the SILS stands for, and we have surgeons who do that at the Adventist Hospital. So we have a very good surgeon who's highly capable of doing that. In addition, in the workup in the pre-operative workup for hiatal hernia repair would require the esophageal pH probe that's placed. It's like a bullet that's placed in the distal esophagus, and we're able to distinguish how much acid is in the esophagus, and that helps us determine whether we should proceed with any surgical intervention.
Is it standard to get some acid? Is it standard to get some reflux?
Sure it is. Occasional, brief acid reflux is very common because we all consume those foods, those caffeines and spicy foods and fatty foods. So it's not unheard of to have acid reflux. It's common and it's normal to have it. However, if it becomes chronic, persistent acid reflux for months, then that's a red flag, and that should bring the patient into the physician's office and get an adequate workup by the gastroenterologist.
Is heartburn hereditary?
It could be if there is a hereditary cause such as underlying hiatal hernia. So what I'm alluding to is hiatal hernias could be congenital, so you could be born with a hiatal hernia.
Final thoughts in regards to our health and our wellness and what you are emphatic about in regards to us having a healthy GI tract.
Right. So most notably, everyone's in charge of their life, their health. So it's in your hands. So all I would suggest is do what you could do, and that is have a healthy lifestyle. Minimize those foods that cause acid reflux. If you're overweight and if that's predisposing you to have acid reflux, decrease your weight by going on a low-fat diet, exercising, and having a good, healthy weight for your height.
Doctor, thank you so much. So you heard it from Dr. Boghossian, and you heard from us all the time here. You are the captain of your ship. Because our mission, as you hear all the time from me, is to make you and help you become the healthiest you can be. Please join us on social media. You can find us on Facebook at AH Glendale, on Twitter at AH Glendale, and on LinkedIn at Adventist Health. And for more information, please visit us on the website at adventisthealth.org/Glendale, and you can always find me at Gregory Zarian. Have a great day. Drink some water. Stretch. Tell the ones you love that you love them, and we'll see you next time on Healthline. Have a great afternoon. Bye.